Hi, this is Walt Fritz from Foundations in Manual Therapy Seminars. I've been doing this gig for a long time now, both practicing as a physical therapist, kind of with manual therapy as my specialty, as well as teaching this work under various names and for various people, as well as myself for the last 15 years. And yeah, the realization is the older I get, the more stuck in my ways I get, like I don't think is uncommon. But what's pretty neat is how, with a little bit of a shove, I've been allowing myself to evolve, not just evolving how I explain this work, which I used to call myofascial release, and now it's just manual therapy, including the patient in so much more than I ever did when I was using myofascial release as my main modality, to the point where the patient is actually guiding the intervention. I'm sort of just the conduit here. Sure, we're giving some input, but they're really driving this process. So one of the things that I found myself getting caught up with is, this is how I always did it. This is how the work is best done. This is what's best for the patient or for me. And a lot of that involved working on the treatment table. When I started teaching this work to speech pathologists, it was a real disconnect because a lot of the SLP population doesn't have access to a massage table or can't quite envision themselves working with a patient in sitting. And I was kind of trying to coerce them into, you know what, you might want to try this, so much so that we included supine work, laying down work, as a primary component of the seminar. Over the years, I've began to become more flexible with that, including more seated type work in the work both that I teach, but is also the work that I use with my own patients. And taught a class in Phoenix just last weekend, and we were in a position where at the last moment we didn't have many tables to work from, and we were essentially forced to work in sitting, which for the bulk of the techniques isn't a big problem. I tend to teach both of them anyway, or at least show them in the hands-on manual that I distribute. But there's one technique that always has sort of eluded me in terms of figuring out a way to be able to pull this off in a seated position. And then through basically being forced to use a seated position and help clinicians figure out a way to make this work, we adapted a technique that if my patient was laying on the table, we do manual cervical traction. Here, hold on to that for me. Manual cervical traction and putting a hand on the sternum, heading down toward the feet. Now, this sort of oppositional type of technique I was taught originally as a thoracic outlet release, but I see it now as being so much more than working that thoracic outlet. It's doing a lot more for voice, for swallowing, for breathing, for neck pain, for headaches, etc. And I was really struggling to find a way to incorporate both of those pieces into a seated position. And because what I had been doing was using Dicem, and Dicem is just a nice sticky product that I use as a grip aid. And whether it's on the skin, hopefully not on the bones like this fella here, whether it's on the skin or now my preference is just working over the clothing, it was very easy to do that sort of input where I'm heading down toward their feet, simulating part of that original technique that I learned. And I even added this little part where you come in right here above the sternal notch and you do a very focused skin drag downward, which creates a super impact in the laryngeal region, the hyoidal region, up into the neck, the chin, etc., etc. But this whole cervical piece, I used to tell people, oh, just don't bother, it's just not effective. And then I was walking around the room in Phoenix, and there was a guy who was acting as the patient, and we were problem solving, we were troubleshooting, and I put the piece of Dicem here, and I'm going to do this without the Dicem first because you kind of block everything. But then I took his neck here, and I teach something called cat grabbing. I learned from Diane Jacobs, and it's really helpful for cutaneous nerve engagement. But I also like to use cat grabbing in the back of the head and neck here to create a nice engagement through the hyoidal region, through the laryngeal region, etc. So what I did was I put one hand here on the sternum heading down, and I added this second hand, and I had my patient lean back just a little bit with a pillow supporting him, and I did cat grab and a little bit of a lift. And this combination of this oppositional force, which I used to think was about engaging the fascia into its layers of barriers and et cetera, that I no longer seem to be the exclusive thing that we're accessing. Now I found that by doing this oppositional type work, or oppositional with some directionality to it, etc., really is engaging for a lot of issues that are facing our patients and our clients in this general region. So I would just invite you to, if you're used to doing this work in supine, where everything is like cervical traction and sternal compression to do that quote unquote thoracic outlet release, challenge yourself. Can you adapt your work into other positions, into other places where your patient might need that functional gain? Because the way I look at it, if we're working with voice or working with swallow, or certainly working with neck and head pain, most of it doesn't manifest when they're laying down. Sure, it's easier on me to work in supine, but what about them? They're experiencing these problems in upright, and working with them in seated can often get a lot better connection to some of those issues that is facing us as clinicians and is facing our patients as their problem. So hopefully I'm going to continue to evolve and figure out new ways to do this work, and I invite you to join me in that process. Check my website out, www.waltfritz.com, and we'll see you next time.